You good to go? Great. Well, good morning, Queensland. Some good news. We only have one new case overnight. That case is a locally acquired case linked with the Sunnybank cluster and is a household contact who has been in home quarantine for their entire infectious period. So again, we thank all of those family members who are quarantining at the moment and ensuring that we are keeping Queensland safe in doing so. We really do put a shout out to you, and again, if you know any of those families, make sure you're giving them a call and just seeing if they're needing any support or supplies so that they can do the right thing and stay home, and we can make sure that we are supporting them. So that brings us to 33 current active cases. We had 17,022 tests overnight and 25,288 vaccinations. So still keeping up very high vaccinations, which is fantastic, and 4.125 million doses. That means we are almost through 50% of the doses we need to administer to all eligible Queenslanders. So keep up the great work, Queenslanders, and we want you to do even more this weekend. We are now at 58.17% first doses and 39.95% fully vaccinated. So that is wonderful news. So this weekend is going to be a huge weekend when it comes to vaccinations. We have our Super Vax weekend happening across 38 of our community vaccination hubs. Of course, we've got other small outreach sites across Queensland, but we will have our 38 big community hubs, which includes our big mass vaccination centres. So the Brisbane Convention Exhibition Centre and also the Brisbane Entertainment Centre at Boondall. All of these 38 centres will be open for their bookings as well as walk-ins. So we encourage people to roll up their sleeve and get vaccinated. Anyone who is 12 or above can come and get vaccinated this weekend at one of those community hubs. We want to make sure people are getting choice. The Morrison government promised people 60 and over that later in the year they would be given choice of vaccines. We know people want to get vaccinated, but there's some who haven't yet. So come out and get vaccinated. We also know our GPs and our community pharmacies are also stepping up and trying to get vaccine out the door as quickly as possible, but we are waiting for more supply from the Commonwealth, particularly for our GPs. And we'll have Moderna coming next week for our community pharmacies as well. We also have the NRL, of course, playing in Mackay this weekend. So tonight, Manly and the Roosters playing, and of course we've got the Panthers and the Eels playing tomorrow. We've got a pop-up vaccination centre there at the game, and we're hoping lots of people are going to come in and either get vaccinated, get booked, or get information about where their closest vaccination site is. So the site will open from 3 p.m. today, so if you are heading to the game, pop over early and get your vaccination. So we do have all of those community vaccination hubs up online now. So have a look where your closest hubs are and what times. We'll have extended hours as well. I want to give a huge shout out to our health workers across our hospital and health services, to everyone, our care army, everyone who's coming out to help us this weekend. Of course, the GPs and the community pharmacies, our private health workers who are coming out. This is a multi-agency, government and non-government collaboration to get as many people vaccinated this weekend as possible. So don't miss your opportunity. Roll up and get vaccinated. I'll now hand over to Dr. Young, talk a bit more about our current cluster, and then of course we'll hear from the Deputy Commissioner.
Thank you, Minister. So yes, excellent news. Due to the fantastic work done by that college, the latest case is a household contact but has been in home quarantine for their entire period. Now, unfortunately for that family, their 14 days starts all over again. So please do anything you can to do to support all of these families, 1,000 of them that are in quarantine. It's so critical that they continue to be in quarantine. They've been doing a wonderful job. Now, our job for the rest of us who aren't in quarantine this weekend is, if you haven't been vaccinated, to roll up to one of those 38 venues across our entire state and get vaccinated. If you have a booking, of course, come forward. You will be vaccinated at the time of your booking. If you don't have a booking this weekend, you can still come forward. Just walk up. You might have to wait for a little while. You mightn't. Have a look at the queues, look at somewhere else maybe, or if you think the queues are too long, make a booking then and there to come back at another time. But this is our chance. We are starting to get that big ramp up in vaccine supply that we've been promised for many months now. It's now arriving into Queensland. Now is the time we can really start escalating. So we're getting more doses. The Queensland Health Clinics, GPs are starting to get more doses of Pfizer vaccine, and next week our pharmacies start getting doses of Moderna. So this is the time to really ramp up. It's taken us since the 22nd of February, when we did our first vaccination of a nurse down at the Gold Coast, to now to get half of the doses out the door. The aim is over the next month to 2 months to get the rest out. It's really important, because although everyone has done a brilliant job in stopping the virus spreading in Queensland, eventually it will start spreading. We can't hold it back forever. So the best response to that is for as many people as possible to be vaccinated. Thank you.
Can I just add to that there's been significant planning gone into this weekend. So we have used our whole of government disaster management frameworks. So all of our local police are engaged in this. People and families can go out with confidence, knowing that this will be well organised and that there will be sufficient resources there to assist them as they go out and get vaccinated. So let's all see that happen. Operationally, it's very busy at our borders. 16,160 vehicles checked yesterday, 191 turned around. We had 6 placed into quarantine as a result of people coming into our state, 6 on-the-spot fines issued at our borders, and unfortunately an arrest at Texas in southern Darling Downs, where a truck driver, having been refused entry into Gundawindi the day before, came through there and decided to drive their prime mover through our barriers, causing more damage. So that person has been charged with unlawfully entering Queensland against the chose directions and also willful damage, and will appear in court at a later date. They were ordered to leave the state in the interim. At our domestic airports, so we remain processing those people. So an aggregated figure to give you some idea, since we restarted the domestic hotel quarantine after our pause, 1,179 persons have been placed into domestic hotel quarantine, and it's basically an exact 50-50 split of returning Queenslanders and people relocating to this state. Overall, masks very good, so only 6 handed out in the last 24 hours, so thank you for that. And overall compliance very good, other than at the borders, where because of the large numbers we are seeing a couple of issues here and there, but overall very good compliance, and we thank the community for that. Thank you.
Before I take a question, I will just mention also that we did declare the local government area of Lismore in New South Wales a hotspot yesterday. That was after New South Wales announced that Lismore would be locked down for 7 days from 6 p.m. yesterday. So we responded to New South Wales lockdown and have declared that a hotspot. That means that that LGA will be treated the same as other lockdown areas in the border zone, and there will be very limited reasons why people can cross the border, but the other areas, such as Tweed, of course, are still open for movement for other essential workers. So we will continue to watch those border zones very closely. Chief Health Officer is getting updated daily, and I welcome New South Wales informing me yesterday that they were going to go into lockdown, and we took the appropriate steps to follow that course. Question? Look, that's certainly what we're aiming for. We've got to remember it is based on supply. We have been getting less than our per capita allocation, predominantly that supply has been taken off primary care. So what we've seen over the last few weeks is Queensland Health has actually been continuing to significantly increase our vaccination rates, but GPs' vaccination rates have been going down because they haven't been getting the Pfizer supply that they were originally going to get. That has been redirected to New South Wales. We've been advised by the Commonwealth that that stock should be replenished to us and corrected sometime in November. So for us to have all of the doses that we require to vaccinate every eligible Queenslander, we do need the Commonwealth to make sure that they're getting that supply to us. We hope it can come to us before November so we can get it out the door as quickly as possible. But I know our GPs and our community pharmacies are doing their absolute best. I think the GPs informed us yesterday they've got about a 2-week waiting period at the moment, but we're hoping more supply is going to come shortly. And I think of the 83,000 extra we got this week, we've given 30,000 of our supply over to GPs so they can vaccinate more people as well. Look, I don't agree. If you have a look at the take-up rate of AstraZeneca across the country, other than Victoria, you'll see that Queensland has actually been administering around the same rate per capita as other jurisdictions, including New South Wales. New South Wales is only marginally above us in the take-up rate of AstraZeneca, despite the fact that they are now 3 months into a lockdown. Tens of thousands of people who have been positive with the virus, and of course over 200 deaths. So we're very equal with the rest of the country, and our messaging has been the messaging of the TGA. If you go into any community pharmacy or GP, they will tell you the same thing that Dr. Young has said and what the TGA has said about who it is recommended for and who should make an informed decision based on the information in front of them. Look, some of that's definitely come into it. There's no doubt we have seen people in New South Wales and Victoria come out in very significant numbers to get vaccinated, particularly because they want to see their communities open back up. They want to enjoy their lifestyle again, and they want to make sure that they do not get sick and end up in hospital or in ICU. So they are coming out in huge numbers to try to avoid that. What we want to do is come out in huge numbers to ensure that we can maintain the lifestyle we've got and not end up in the situation that we are now seeing in the eastern states and territories. Look, so the international arrivals is being trialled with South Australia at the moment. That was agreed with National Cabinet. We'll see how that trial goes. But we're very pleased to have been able to implement this, one, to allow us to have those boarding students who are Queenslanders but who board interstate be able to come back to Queensland for school holidays. So we're trialling it with that cohort so they can quarantine with their household. And we're also trialling it with everyone who's now going into home quarantine who's been a close contact of community transmission in Queensland. So we'll see how that trial goes. We're working through that system. We want to make sure it's working and working properly, but it's certainly another level of protection to ensure compliance, because as more people go into home quarantine, and we saw how many we had from the Indooroopilly cluster, it'll give us that added level of surety of compliance, but also it will help us improve checking on people's welfare.
The Sunnybank cluster.
No, they're not going to know when that message is coming. They will get at least one message, so it gets sent as a link. So they must have a smartphone. If they don't have a smartphone, then you must have a landline, and we would be using our normal compliance system that we've had operating since very early last year. But if they've got a smartphone, they'll get sent a link. They must open that link within 10 minutes and answer some questions, which goes to whether they're feeling well, whether they need support. But that will also tell us whether that smartphone is at the residence in which they are required to be quarantining. And if they're not, then it will be followed up to see if they have actually left those premises unlawfully against the direction. Oh, look, we're not going to send it at 2 o'clock in the morning, can I say. We've never rung people at 2 o'clock in the morning since we put this system in place in April last year. But they will get at least one text and they are required to respond, but they could get more. They could get 2 or 3 during the day. It only takes a couple of minutes, but it is really important and it gives us that added layer of protection to ensure people are complying. Look, what the Doherty Institute modelling says is that we will be able to reduce the restrictions that we have in this state when we reach 80% fully vaccinated and if the jurisdiction has the virus under control. In other words, they're identifying the virus, they are contact tracing and they are quarantining people. So I think quarantine will be with us for some time. Well, certainly what the Doherty Institute says is we'll still have some restrictions, and we are hearing the UK, the US still talking about putting families back into lockdown, schools closing down again, so there'll still be a need for some restrictions, but they'll be a lot more targeted. Look, we will wait. We'll follow the advice of the Chief Health Officer and the health professionals across the country. Let's get to that 80% fully vaccinated rate. Let's make sure that every single state and territory has the virus under control. They're able to test, contact trace and quarantine. If we can all do that, our economy can open up very quickly. Look, that's all being discussed by National Cabinet, so I'll leave it to them to have those discussions and any announcements. Tim?
The Minister started when those 3 gentlemen came over the border. Now we've seen throughout the pandemic a lot of, especially recently, a lot of people coming over for medical treatment or a number of different reasons they have to hold out and fly back. It seems odd that they're allowed to have 2 people drive 1 man over the border, both of them COVID positive. Why were 2 people allowed to drive?
Look, I am not aware of the details around that. I know that they were given a valid exemption and we have been, because of where we're getting to with our vaccinations, where we're getting to with our testing and our level of comfort at the moment, that the exemptions unit have been working through what is the appropriate approvals to be given. We have always said to people that if they travel interstate, they should expect that they may need to seek an exemption or at the very least hotel quarantine, and they would probably have to travel by plane. We've said that so that people are not getting in cars and driving from town to town to town that all have infections, that they're stopping at service stations and shops in towns where there is community transmission. So people who are driving interstate and trying to come back by car need to understand they're putting themselves at risk and the community at risk. But I leave it to the exemptions unit to decide, based on all of the individual circumstances of each application, what ones should be allowed to drive over or not.
But then he's then travelled up to Maruka and stayed with people, obviously in the same household. Was that allowed?
Look, police were looking into that, so I'll see if the Deputy Commissioner has any more update on that. There's a couple of things here. Firstly, we look at, have they got a valid right of entry or exemption to come into the state? Secondly, what was the instructions for that exemption? Were they allowed to come in to do one thing? Were they to quarantine? What was the requirements around that? So I don't know the details of whether these gentlemen breached the approval they were given, but certainly the police have been looking into that. So I might just ask the Deputy Commissioner if he's got an update on that.
Last couple of questions now.
Sorry, Tim, social distancing got me. I couldn't hear the question.
Look, just in terms of the men who came over the border, obviously they were given an exemption, but that man then travelled, they were taking their father to hospital treatment.
Oh, yes, this is the one, yeah, on Father's Day.
He
Yep.
travelled up to Maruka and stayed in the household. Wondering, is that allowed, and is there any investigation?
We've completed our investigation in that in terms of the entry into it and what happened when they came across. They have been completely compliant with the conditions and they haven't broken any laws. We're not taking any further action. Now, I'm not going to get into the details of that because the reason for this person coming in, which are valid, are private. So these are people that are not being prosecuted and are entitled to their privacy. So I will assure you that it was looked at very closely. There has been no breach of the law, and we're not taking any further action. The truck driver is an interstate truck, so I don't have the exact details around that, Lydia. So. Yes, they were directed to go back to New South Wales, and that as part of that process we'll do all of that. But we're not doing that type of testing as yet. There is a regime nationally for freight where they have requirements to undertake certain testing. So in terms of that, that's not the issue here. The issue here is that person was turned around. They didn't have a right of entry at Mangundawindi, chose to go to another border crossing at Texas, tried to drive through it in a truck, which didn't work, and they have been arrested and then charged, and they'll appear in court in due course. Thank you.
It really depends where we're at, and it depends on the individual. So we'll work through the policy. I'm sure it won't be the same policy we've got today, but it will just depend.
Sorry, I just mean like, are you waiting until we get to 100% vax before masks don't get
No. So we review the policy every 2 weeks. So we'll be reviewing it next Friday.
Dr. Young, is there a particular...
So that's a discussion National Cabinet's having. So there are thresholds. So there's the entire country, then there's states, then there's going down to specific communities. So a very astute question.
Dr.
Thanks.
Is
Young,
that something that you recommended to the government, or was that something that you
It was always going to happen. So you would remember that early on, the Commonwealth said once there was enough Pfizer available that it would be opened up to everyone, and we saw South Australia, Northern Territory, West Australia put it in place, and then we've put it in place because we have enough supplies that we can use our Pfizer.
is there a particular age group you're targeting this weekend? Is there a particular age group that's been reluctant to get the jab, say the 60s to 70s, or is there a particular age group you're targeting?
No, it's been really related to when people have had access. So we know the over 50s have had the most access because they really got access earlier to AstraZeneca, and then younger people came on board, initially the 40s plus, and then more recently down to 16, and then even more recently down to 12. So you can see that in the numbers. The percentages are all there on our website. But you can just see it's when it's been made available. So this weekend is saying very loudly, very clearly, anyone 12 years of age or older can now get vaccinated. There's no priority groups. It's just anyone. Yeah, we have seen some of our regional areas, and it's access. It's getting the vaccine out there. It is much harder for someone who's got to travel for a distance to get vaccinated than it is for someone here in Brisbane that can walk up to one of our mass vaccination centres.
Can I just ask for truck drivers, do we have a number now for how many positive truck drivers have? And also, do you think that policy should change around mandating vaccinations?
Yeah, so we are definitely looking at that, and it's been looked at nationally for the policy. But look, can I say the vast majority of truck drivers, when we've caught up with them because they've tested positive, have actually had the first dose. They've really been doing very, very well. They now need to, and they will, I have no concern about it, they'll go and get their second dose, and that will be even better. So I think we're up to 11 now since the 24th of August. So they're just coming through, and you'd expect that because the biggest group coming across our borders are our freight drivers, and thank goodness they are. We need them to cross our borders. They've got to move freight around the country, and they've been fantastic in what they've been doing.
Say something on that as well. So Minister Bailey and I will be speaking meeting today to further look at the protocol around freight drivers, because we do want to make sure we absolutely need our freight operators moving around the country. We need products getting into stores. We need our grocery items to be there to support our communities. But we do want to look at the movements of drivers and what the protocol is around them quarantining and limiting their movements, because we are concerned that these drivers, when they are coming back home or where they're travelling around, they're going to shopping centres, they're going to people's homes, they're going to other places that are risking transmission. So we're having a look at that protocol at the moment as to whether we need to be making further changes to it, or whether we need to be messaging even stronger with the freight drivers that we're trying to do the right thing by the drivers and making sure that they can travel freely across borders, but we also need their cooperation to make sure that they're not putting people at risk while they're not driving and going out into the community when they're still waiting for test results. Well, we've got a protocol in place with FIFO. That protocol's been working very, very well. We've had very, very few incidents of transmission with FIFO workers.
If this weekend is about supply, and last one, allowing people to have a choice to vaccines if they're eligible for, why hasn't the state done such a thing as a set with younger people?
Sorry, I didn't understand the question.
The Christmas weekend
Yeah.
is about now having supply, allowing people to have a choice for the vaccines. Why hasn't the state opened up such a
Oh, well, for AstraZeneca. AstraZeneca has been available to anyone under the age of 60 if they wanted to go see their GP and have a discussion and make an informed decision to get it. So people under 60 have been getting AstraZeneca, but it's been available through the through GPs and then through community pharmacies. So we've been making sure that our supply's been going to GPs and community pharmacies who can have that conversation and ensure anyone under the age of 60 who wants it can get it. So that's already been happening. We have been prioritising Pfizer because we know that Pfizer has been more difficult to manage in the cold chain supply, and we've been managing that through our community hubs. So it's been a collaborative effort. GPs and community pharmacies have been delivering AstraZeneca. Queensland Health's been delivering Pfizer. Now we're all starting to move into the same space. GPs are going to have Pfizer and AstraZeneca. Community pharmacies are going to have AstraZeneca and Moderna, and the Queensland Health are going to have Pfizer. We've got AstraZeneca, and we'll wait to hear from the Commonwealth whether we're going to get Moderna and when. So there's going to be lots of choices out there for people. What we didn't want is from next week, everyone under 60 having 3 choices and anyone who's 60 plus only having 1. It's about time everyone gets the choice of different vaccines that are available to them, and that's what this weekend's about. Thanks, everyone.
It's a day to celebrate.